Hi, in this video we'd like to discuss intrauterine adhesions, also known as IUA, is what we term it medically. So intrauterine adhesion is simply a medical condition where there is adhesions forming within the uterus. Now when this condition becomes severe, we usually name it Asherman's syndrome. The most severe version is Asherman's syndrome, but if you have a slightly severe version, not too severe, moderately severe, then we will still deem it as IUA, intrauterine adhesions. And intrauterine adhesions is a condition that can cause infertility and also recurrent pregnancy loss, because it can actually affect your ability to get pregnant, not only the conceiving process, also affecting sustaining a proper pregnancy, because there's so many interruption in the blood flow, affecting the fetus development, etc., causing this early pregnancy loss. So intrauterine adhesions can also cause other symptoms, although they're not always obvious. So we do need a diagnosis. Some patients may have this condition, but they never realize it until when they go for their medical checkup and they do some diagnosis, or even until they experience pregnancy loss, miscarriage. Only then they will find out that they do have intrauterine adhesions. So some of the symptoms that you want to look out for is that you have infrequent menstruation coming and going, and then you also experience some pelvic pains, abdominal cramps, and furthermore you might experience no menstruation at all. This is another distinct symptom of intrauterine adhesions. So we do need to actually go for proper diagnosis. When we do diagnosis, we usually diagnose it with some other underlying condition. Most cases we see that these women do already have some form of adenomyosis alongside with this intrauterine adhesions. So the cause for this intrauterine adhesion is not a congenital one. Patients are not born with this condition. You acquire it, and how you acquire it is via certain surgical procedures. For example, let's say you've done certain surgeries of the uterus, you might have a history of C-sections, and the most common cause being D&C procedures and induced abortions procedures, where they scrape the inner lining of the endometrium to remove the fetus. This can cause surgical trauma. So what you need to look out for, the key word here is surgical trauma of the uterus. If you have a history of that, any type of procedure that may cause some surgical trauma, it very likely can cause these post-operative adhesions. Even for treatment, we need to be very careful when we do treatment for this as well, because treatment alone, because it involves surgery, it can cause further adhesions as well if it's not done properly. That is why at Antai Hospital we do not use the conventional approach where they use electric knife, hysteroscopic operation. It can cause it to be much more severe than it already is. So there is a technique required for the treatment of intrauterine adhesions, also known as Asherman's syndrome. So at Antai Hospital, not only do we need to have a direct visualization for the removal of these adhesion tissues, because we want to not cause further harm, and we need to remove all of these tissues carefully and all at once as well. These tissues we can compare them to scar tissues, because the endometrium is trying to heal itself from the trauma, but then it causes obstruction further along down the line, which is all related to all the complications and symptoms. So once we do the removal, the next step at Antai Hospital is that we need to place our bioadhesion barrier to actually boost the local environment, to actually have a higher recovery and also prevent the formation of these post-operative adhesions. If done properly and with the correct surgeon and with the right skill and experience, these adhesions can be removed, and then they will not return in the future. So after treatment, what we can guarantee is that you will begin to menstruate regularly again without all the pelvic pains, because usually these pelvic pains are caused by the menses, blood accumulating within the cavity because of the obstruction, and then they may even leak into the pelvic cavity as well. This can be eliminated, and most importantly, you can now achieve your fertility goals, which is pregnancy without any miscarriages. That is what we can offer you at Antai Hospital so that you can get pregnant and also start a family without any complications, without intrauterine adhesions standing in your way. So do get in touch with us via the website if you'd like to find out more information about intrauterine adhesions, also known as Asherman's syndrome, how we do diagnosis and how we do proper treatment to ensure that you have a healthy pregnancy.